We do have a system on the other side too, where too much volume, too much pressure also has a feedback system. Now, it is less common, and quite frankly, usually we are at fault for this because we like to give patients fluids for a variety of reasons. So oftentimes this little pattern is iatrogenic. The other place that you see this is in heart failure, all right, when the heart starts to not work right. But, okay, so here's our normal homeostasis. We get an increase in blood pressure and volume, okay? And I would say in particular, the issue here is that you have too much volume creating too much pressure. So essentially your venous return is too high, your cardiac output is too high, okay? So how does the body respond? Well, if we have lots of blood volume, the atria get stretched before they contract, okay? That atrial stretch, we talked about those receptors, those low pressure stretch receptors. Now we see where they play a role. When EDV is very high, the atria detect that stretch and they release natriuretic peptides, particularly ANP and BNP. Atrial natriuretic peptide and blood natriuretic peptide, okay? Now, they do what their name says. Natrium, remember, is sodium, right? Natriuresis is peeing sodium, okay? So these are natriuretic peptides. They're going to increase the excretion of sodium. Now you know that water follows salt. So where the sodium goes, the water follows along behind. Okay, so these natriuretic peptides are released by the heart. They travel to the kidney. They increase the amount of sodium loss in the urine. That pulls water towards it by osmosis. ANP and BNP also reduce thirst and inhibit the renin-angiotensin-aldosterone system. All of it. ADH, aldosterone, even the epi and norepi release from the adrenal glands. And then natriuretic peptides also cause peripheral vasodilation, reducing total peripheral resistance, right? So what have we done here? We've reduced body water by increasing urine output, and we've reduced total peripheral resistance by causing peripheral vasodilation. Both of those things will reduce blood volume and pressure and get us back to homeostasis again, right? So this is the volume too high, too much plasma volume routine, all right? Now, this is normal, like this is a normal patient. All of these are normal homeostatic diagrams. When you start adding disease into here, things get more complicated, right? You know, like I said, heart failure plays a role in this particular disorder, but it's a vicious cycle because the issue with the heart is that it's not pumping out enough, right? So we end up with kind of a death spiral.